Hi, Dr. Mark.
Hello, Erin. How are you today?
I'm good, good. I just wanted to introduce myself to all of your patients and new patients to come. My name is Erin Vargas, and I'm the new practice manager at Younique Cosmetic Med Spa. I'm super excited to be here, and today we're talking about a really serious women's issue, urinary incontinence and sexual wellness. So today we decided to make a video for everyone, for anyone suffering from urinary incontinence. Doctor, can you briefly tell us what constitutes urinary incontinence? What is that?
Absolutely. Well, just to give you a little bit of background, also, um, this is a subject that's near and dear to my heart because I was uh, an OBGYN for several years of my career. I'm double board certified. So I did 5 years of OBGYN and 15 years of cosmetic surgery. So this is a nice subject to talk about because we are able to discuss both the lifestyle and cosmetic benefits of this treatment, but also the incontinence and kind of the medical side of the treatment. So, stress urinary incontinence is basically when we leak urine during stressful pressure in the pelvis. For example, when we play sports, or when we cough, or when we laugh really loud. A lot of people, whether they've had children or not, actually have leakage of urine, which can be not only embarrassing, but can inhibit your activities of daily living. And believe it or not, actually, 1 out of 3 women will eventually have urinary incontinence symptoms, and even up to 25% of collegiate athletes will actually also have stress incontinence symptoms, even if they've never had children.
Wow, I didn't know that. As a mother, I know the having to sneeze or things like that after childbirth, but I didn't know that athletes that was even a thing for athletes that didn't have children.
Yeah, you think a lot of athletes have strong muscles, but a lot of times these pelvic muscles get a little overstressed, or just genetically their anatomy isn't able for the muscles, especially around the bladder, to kind of hold the urine in as tightly as it should.
Okay, okay. So we did get a survey of questions from some of your patients. So what is the name of the procedure is Viveve, right?
Correct.
Okay. So Viveve, I know that there have been previous traditional treatments for urinary incontinence, but how is Viveve different?
So there are several older treatments for urinary incontinence, and that includes pelvic floor physical therapy. You've probably heard of Kegel exercises. A
Yes.
lot of people do those after having children to strengthen their pelvic floor muscles. There's pessaries, which are these vaginal inserts that help put pressure on the bladder neck to hold the urine in, which they can be very uncomfortable and also very messy. There are also invasive surgeries. There's injectables that you can inject around the sphincter muscles of the bladder. And there's also invasive sling or bladder mesh surgeries where you actually insert a mesh around the neck of the bladder to tighten the muscles and not allow urine to flow as easily. A lot of these older traditional treatments can be very invasive and very costly. So the Vivive is
Sounds
a
like it.
nice, yeah, the Vivive just gives you a nice, newer, alternative way to improve stress urinary incontinence.
Okay. Is it a one-time treatment or do people have to come in for several treatments? What does that look like?
The Vivive is a wonderful one-time treatment. Many of the alternative vaginal laser treatments are 3 to 5 treatments,
Okay.
but Vivive is the only single 45-minute treatment available on the market right
Okay, that's good to know. I mean, for anybody that wants to do that, to only do it once is probably the best thing because we don't really want to do it 2 or 3 times over.
now. Exactly.
Now, so we talked about how it's great for urinary incontinence, but what else is it good for? What else? How else can I benefit from something like this?
So a lot of people don't know this, but when you do a radio frequency laser in the vaginal area, like Vivive, you get a lot of other benefits, and the main benefits are sexual wellness benefits. You get increased lubrication. You get better texture and tone of the vaginal wall. A lot of patients will express um, better ability to achieve orgasms. And all of this is because of the new collagen and elastin that's being built by the Viveve laser.
Wow. So that really helps people that are, have had children or are just a little bit older in age and want to just kind of improve that part of their body, right?
Exactly, improve their lifestyle. It's an uncomfortable subject to talk about and bring up with your doctor. It can also cause things like depression. It can also cause skin irritation. Like if you have urinary incontinence or you have vaginal dryness,
Yeah.
uh, a lot of this irritation can cause inability to have sexual relations. It can
Yeah.
make it difficult to kind of do the things you want to do. So this is a great way to kind of just improve your overall lifestyle.
That's great. That's great to know. I'm sure that it would also improve a lot of relationships.
Yes, no one's
So
ever complained of better sex.
no, absolutely not. So who would be a good candidate for something like this?
Great candidates, pretty much anybody who's over the age of 18. If anyone is experiencing any sort of urinary leakage symptoms, whether you're sneezing, doing athletic exercises, whether you're coughing, if you do notice any leakage, any of those patients are great candidates. Anyone who's at least 6 months after having birth or nursing,
Okay.
um, or anyone who just wants to improve their sexual wellness.
Okay, great, great. So sounds like just, women who are having these symptoms can really take advantage of this, right?
Absolutely. There's very few contraindications.
Now I'm thinking about like so results, what are they really and is it what is the like longevity of that procedure? Do they have to come back a few years later?
With just like any rejuvenation procedure, nothing lasts forever. I always think about it as turning the clocks of time back. So as we get the improvement, the typical results are about 30 days. People will notice a difference, but it takes about
Okay.
90 to 100 days for collagen to mature in your body. So we always think of this 100-day rule. It takes about 100 days for your body to make collagen from beginning to end.
Okay.
So once when the heat from the radio frequency tightens your existing elastin and collagen fibers, but also the heat stimulates new collagen, which takes that 90 days, then you start to see the maximum results at 90 days. However, a lot of women will start to notice improvement even after 1 month. And if they do
Great.
get to their best results at 90 days, we typically recommend doing this every few years to kind of maintain that result.
Okay. Okay. So, I mean, if someone really loves how how they feel afterwards, they can come back in a couple of years and get it done. That's awesome.
Absolutely.
That's great. One of the questions that we did get is what is the treatment like when someone's coming to your office? So they're coming for the first time, that it's treatment day. What can they expect there?
That's a great question. So it's a very simple treatment. It's one of the easiest treatments to do. You basically come in, you check in, we change you into a gown, and just like a normal gynecological pap smear visit, you're in a normal, regular room with stirrups. The Vivive laser looks like an ultrasound wand. It's like a small little wand that's inserted. Most people think that they're going to feel something hot, but there's actually a cryogen cooling mist that cools the surface of the vaginal tissue so that the heat can actually penetrate. Most patients takes about 45 minutes for the treatment, and most patients can actually have a conversation with their treatment provider because it's virtually painless.
Okay, that's good. Oh, so that was my next question. Is it painful?
It is one of the least painful procedures we have here in the office. It's very comfortable. Some people will feel some mild warmth, a little bit of heat, but nothing that people would say is uncomfortable.
Okay, let me ask one question that comes to mind right now. If someone has an IUD, how what does that work? How does that work, I should say?
As long as there's no metal devices or metal implants in the body, you can actually have this procedure with any sort of contraception.
Okay.
If you have a Paragard IUD, as long as the vaginal walls are free and the radio frequency doesn't have any metal devices to interfere with, you can have this procedure done. Metal devices are things like hip or knee replacements or like some sort of electrical pacemaker. Those are
Okay.
really the only devices in the body that are kind of contraindicated.
Okay, that's good that you said that because that leads me to the next question. Who should not get this procedure?
Okay. So, in addition to electrical devices or people with metal implants, people who are having very serious medical procedures, things like chemotherapy or radiation, or if you're pregnant or if you're breastfeeding, we usually want people to kind of be at their optimal health state.
Yeah.
And if you're undergoing any of these procedures, the procedure may not work properly for you. So, if you are pregnant, if you are breastfeeding, if you do have any implants in your body that are metal or electrical, or you're going through chemo or radiation, we just generally ask you to wait until all of those things are kind of over.
Perfect, perfect. So I just want to say, is there anything else that you can think of that women might need to know if they're considering this procedure right now?
I think if any woman is interested just in improving their sexual health and their sexual wellness, I know it's an embarrassing topic to talk about, but if you want to just improve your uh, sexual wellness, whether it's achieving orgasms or if you notice just even mild urinary incontinence where it's not really that bad yet, this is the best time to do it. It's such an easy, non invasive, quick procedure. It really is a wonderful treatment, and we're so glad to be able to offer it.
Great, great. Well, thank you so much for giving us this information. It was such an important issue that I was happy to interview you about it and be able to ask those questions for many women that have these types of issues. So, thank you so much. Lastly, I know that our office, has a discount for watching the seminar. And for everybody watching or watching this webinar, I should say, for anybody watching, if you mention this webinar when you call into our office, the discount is $250 off of this procedure. And we just mentioned this webinar. Was there anything else that you wanted to add?
No, we look forward to meeting all of our new patients, and thank you for watching.
Thank you, everyone.